Good afternoon, everyone, and welcome to the So You Know Facts on Men's Health and HIV webinar. I'm Destiny, the media strategist for Seeds of Healing. Seeds of Healing is an HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma. Our work seeks to eliminate disparities for Black women living with HIV. This webinar is being recorded and will be shared on our SoTime platform and posted to our YouTube channel for you to share with others or come back to watch yourself. Attendees are able to drop questions in the chat box and will be shared at the end of the webinar, but these will not be anonymous if you use the chat. If you wish to ask an anonymous question, please use the Q&A feature and feel welcome to ask questions and write comments throughout the entire program. Before the webinar begins, please give a warm welcome to our panelists today. We have Christopher Marville, who has been a resident of Wilmington, North Carolina since 2009, but considers Raleigh, North Carolina home. And Christopher was diagnosed and has been living with HIV since 2016 and hopes to use the platform to erase the stigma behind HIV and give newly diagnosed individuals in the community mental and medical support. We have Dr. Mackie King, who studied biochemistry at the College of Charleston and graduated pharmacy school from the Medical University of South Carolina. He completed 2 years of postgraduate residency training at the University of Colorado Hospital in Denver, Colorado. He has worked in an internal medicine clinic with an HIV clinic for the last 8 years, where he helps to manage patients' chronic conditions like diabetes, high blood pressure, hepatitis C, HIV, and more. He is a board-certified pharmacotherapy specialist and is recognized by the American Academy of HIV Medicine as a pharmacy specialist. And we have Montrel Miller, who will be facilitating our session today. He is a local to Southeastern North Carolina and has worked in communicable diseases for over 10 years. Whilst working in community health, he has spent his last 8 years working directly supporting the HIV community, and these activities include grant writing, rapid testing, harm reduction, and patient navigation. And with that being said, welcome panelists, and I will turn it over to you all.
Good afternoon. Wow, those are some long introductions. I guess my first thing is I want to start with the why we're here. I feel like we all know what we're doing here, but I think the deeper or the bigger question is why. And I'll start with Chris.
Well, why I'm here today, what we're here today, is to speak about just trying to kill some of the rhetoric or the bad vibes behind the word HIV. Like even some people are scared, afraid to say it sometimes, HIV/AIDS, they're afraid to talk about it or say it. So I just wanted to give more education on it and not like make it feel like it's a death sentence or make it feel like you're a bad person. I know that when I first got diagnosed, my biggest fear was people were gonna think I was a whore because that's what I thought, that's what I equated that the illness to or the infection to. But now that I'm more educated and understand, my thoughts of it have changed. So I'm just here to maybe change a few people's mind, give some education if I don't change their mind at least.
Okay, love that. Dr. King?
Hey, yeah, thank you. So I am here to help try to answer whatever questions may come up regarding some of the options that we have in trying to prevent HIV or treating it after you might have accidentally been exposed to HIV as well. To kind of hopefully help people answer whatever questions you may have about the medications to make you feel more comfortable understanding the risks that exist with taking the medications, without taking the medications, and just try to, again, demystify the stigma that's associated with this. You know, it's a great thing. We have great medications that can treat HIV as well as help prevent HIV. And so just understanding the risk versus benefits there, hopefully, is my role today.
Oh, yeah. So as she highlighted earlier, for about 8 years, I've worked in the field of HIV, and in fact, I've done a lot of rapid testing. And then at about 2017, 2018, we started, we shifted to like this opioid epidemic in which we see the rise of harm reduction And harm reduction could be safe syringe exchange. It could be providing safe sex contraceptives for sex workers or just for anybody in general. I'm wondering, have you noticed that same trend on the pharmacy side? Whereas I know there's been about a 30%, there's been about 30% positivity rate for those who patronize our harm reduction services for hepatitis C. Far less for HIV, maybe about 1 to 2%. But have you seen any trends on the pharmacy side that that's a comorbidity between HIV and Hep C? And if there are medications that treat both that do not cancel each other out?
Yeah, that's a great question. So we are certainly seeing increased rates of hepatitis C, particularly, so we call it the co-infection, so patients who have both hepatitis C and HIV. The great thing, though, is that hepatitis C can be cured. So we have medications that you only have to take for 8 weeks or 12 weeks, and then you're done with it. We might do some testing follow-up to make sure that it is indeed gone, but it's pretty fantastic. You take a pill 1 time a day, and then after 8 to 12 weeks, you could be completely cured of hepatitis C. And we know that if you have HIV as well, and your HIV is well controlled, so undetectable viral load, it makes it even easier to get rid of that hepatitis C. And the last great thing, kind of like you asked, Montrel, is the medications, they work in general very well together. So for the medicines that people are most commonly on for HIV, there's generally not very many interactions between the medicines we use to treat hepatitis C. So they're different medicines, but remember, you only have to take the Hep C one for about 8 to 12 weeks. There are instances where drug interactions might exist between the two. So I'd always recommend kind of going over that with either your pharmacist if you have one in clinic or with your doctor. But in general, they play very nicely together. It's very easy for us nowadays to continue to treat HIV and keep it well controlled and then get rid of hepatitis C altogether. And the other benefit is they're so much better tolerated than they used to be back in the day when you were on injections and all kind of different stuff. I've never had a patient stop treatment for hepatitis C because of side effects.
And part of that was to I guess that was an effort to decrease stigma because there's been many rumors and stigma associated with HIV. However, we've learned that those stigmas and things are not necessarily law. And that's why I bring up the harm reduction piece, just because I've seen many people come through and the way that they were transmitted, the way their HIV was transmitted was through the sharing of syringes and whatnot. So I definitely wanted to highlight that. And Chris, any trends you've seen lately? I know that you work in the field now as well. So like any trends that you've seen and things that you wanted to highlight?
I agree. There is a big, for most of the times I get tests, most of my tests pop up positive for Hep C when I do tests at different locations, specifically at the harm reduction. But again, that's just from syringe reuse. And then a lot of them are already in treatment, but the antibodies for Hep C stay in your body for a long time. So it'll pop up on positive tests for a while. I'm not sure exactly how long, but it will pop up for a month and you'll be in treatment. You'll be all healthy and better, but your test will still read that because the antibodies are still in your system. And then there is like a stigma behind it because people are, like you said, there's like that weird thing. It's like, oh, this is only like the gay disease. So when you do tell people like, oh, you have this, blah, 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 they're like, well, that's not possible. I don't have sex with men. I'm not a man that has sex with men. And so, just trying to give education on that part too. But yeah, that's what I've been noticing. This is a Hep C rise in the area.
Yeah. And I wanted to highlight that. I mean, just exactly what you said. It's I think the latest CDC statistics saying there's about 13 to 14% that have HIV and don't know it. And you're highlighting the rapid testing portion. Why do you think people are apprehensive about knowing their status?
Because if you don't know, you don't have it. That's the not the ignorance behind it, but that's the thought behind it. If I don't know, it can't be affecting me. If I don't have this, I can't be sick. If I don't know about it, then it doesn't, and then it doesn't make sense for me to have it because I'm a married woman to a man, or does it make sense for me to have it because I'm a straight male that only? So it's like if you just ignore it, it goes away in a sense. So it's like, yeah, why would I want to know these things if I don't? And most times, especially for men of color, we only get tested when our partner pops up with something. So we only get tested by proxy. It's very rare that we go to the hospital or to the doctor and get stuff looked at unless it's like dire need. So just that whole like machismo, macho, like I'm good, I'm fine. It's just a little cough, it's just a little this, and not getting it checked out is is what I think is leading to that weird stigma. And that's what this adds to the stigma about the whole situation. Because if we're all ignoring it, then it can't be real and it can't be effective.
Right, and I would add to that. Again, rapid testing for some years. That's oftentimes a difficult conversation to have with two heterosexual people. Like, do you want to get tested? I don't think I should. I've been married. Only my husband. I was like, so the way this works is, like that type of thing. That's a difficult conversation sometimes to have with people.
Because then they lash out at you like you're the one, like you're trying to tell them something about their life, and it's like, no, that's not what I'm doing. I'm just trying to offer another way. Like, hey, just take if you what would be the harm of taking the test? I tried to be like, well, what's the bad? What can come bad from it besides you if you've already had it, so now you know you can get treatment now. So it's like, what's really the bad part? I mean, the fear of knowing is a big fear. That's a big thing. But other than that, then if that's your only thing, then I'll say go for it. But yeah, I try to be really gentle with people because I get it. Because I was there at one time. I mean, people trying to tell you, you get that call. It's not a very fun call. Your stomach drops, all that. So it's like, try to be a little as sensitive as possible. But it's also like, we're all adults here, and this is very important for your livelihood. Trying to. I've been realizing now doing harm reduction that you have to kind of trick people, or not trick, but kind of persuade people to come take care of their own health and their own mental health and own physical health, which I get, but it's like, take some, your own autonomy.
Yeah, and at the same time, I guess the one carrot in front of the horse that I use is well, if what's the harm in actually taking the test if if you think you're good, like, so why not just be for certain that these things are true? Right, right.
Prove me wrong, please. Yeah.
Yeah, no, I think it's one of those things where we try, back in, maybe about 5, 6 years ago, before COVID, it was more frequent and more open that we could test at events, and whatnot. And then I guess the stigma itself still lingers because now we're tightening the reins and making sure that we have the most confidential areas, which is necessary. But I guess we think about it more intently and more deeply about having to give those results. Positive results. That's a bit of a mountain to climb. However, we have good news in the fact that like you said, it's not a death sentence. It's not. It's really something that's very manageable. And it's highly tolerable, just like Dr. Mackie was saying. But and Chris, I think go ahead.
Well, I was just going to say, I think you're providing very valuable information for those listening. So I think we would all agree everybody should know their status, right? But for those listening, who do y'all say, who are the kind of the top people who should really think about getting tested?
Like the top groups of people?
Yeah, like the highest risk factors generally.
It's people that use injection of drugs, people that are in the sex work field, people that have MSN, like men's sex that have with men, and yeah. And I also feel like it's also for people that are in the medical field too, because there's a lot of accidents with syringes, people getting stuck on things of that nature. So I feel like it's also good for them or people that's in that field in general to get tested just to make sure that they have like in the extra infections from all the other things.
Yeah, that's a really good point.
You got to be cautious, but things happen still.
Right.
Yeah.
Right.
I also think about people who may have had a different sexually transmitted infection within the last 6 months. So, gonorrhea, chlamydia, syphilis, because that could be an indicator of perhaps inconsistent condom use. So if you're not using condoms regularly, if you had an STI in the last 6 months or so, that might also be another clue that, maybe I should take that step and get tested.
One comment says people who are married and seem to jump right into infidelity when their partner could use drug paraphernalia, that makes them vulnerable. Also, absolutely. Wow. Yeah, that, I mean, it's one of those things. It's like, if we don't think about it, but that doesn't make it, less real. It's more so your perception. So are there any other myths or misconceptions about HIV and STI transmission that you want to address, Chris?
I think just like the transmission in general, I think people get confused of how it can be transmitted. Because I remember when, like, I'm a '90s baby, so like back in the '90s when like HIV was really and AIDS was really bad, my Nana Helen, which is my great grandmother, she would always be like, "Oh, don't touch that. Don't look. Don't like." She was so cautious because she thought it was going to, like, HIV was going to jump on you, because that's what they pretty much made scare commercials, which were kind of effective in a sense, but not really. They're a little bit different today. Our commercials are very like happy go lucky. Everybody's at the beach, everybody's dancing, which you can live a very happy, healthy life with HIV. But I feel like a little bit of that, it might sound wrong, but a little bit of that fear should still be there. A little bit of that education and fear should still be there. Biktarvy's great, but it's not going to change your life. These PrEP and PEP, these are great things, but not going to change your life. And yeah, just like HIV has no direct name on it, so it is not just for Black men, it's not just for Black women, even though we're some of the highest in the rates of it. It could be anybody. It looks like anything. HIV is just not one face, and it doesn't look like, people always say, I can tell you have HIV, or by the look of this and by the look of that. I'm like, you can never look at somebody and be like, oh yes, you have it. You just never know. So just trying to kill the ignorance behind that stuff.
Yeah, that's wow. That's a bit brash. I think I don't know, just the audacity to say such a thing. I can, by the look of this and look at that, I can tell.
Yeah, I had somebody legit tell me last week that they know when they're messing with somebody, they can tell like certain indications on them of, oh yeah, you might be positive. And I'm just like, that could be just anything. That could be just their natural look, but that, again, that's their mind making sure that they're like, okay, cool, I feel a little better about this. So if I can kind of tell, I can kind of avoid it, and then I'm good now. But you're still not using contraceptive. You're not still protecting yourself, but because you think you got somebody that's nice and healthy.
So, and what do you think? And this is for I guess the both of you, because we might be at the top of the South, but we're still in the South. So, what do you think the barriers are to ending the HIV epidemic in the South?
Stigma in general, fear, just lack of resources. I've seen that, like, poverty or just lack of resources is one of the biggest things. And just not having the funding. When I first was diagnosed, I was on my parents' insurance. So life was good. I was getting medication. But once I turned 27, I think I got kicked off my parents' insurance. And just that time between, like, luckily my doctor was able to get me some more medication, but so I could last over. But that time between just trying to find insurance, understand what the Ryan White was offering, understanding like trying to get it through my job, but they were giving me some, stuff like that. And just getting the education behind it and making sure you're getting the proper care, making sure that the medications you're taking are actually working for you and not against your body. Because it's not like the back in the days when we had like a pill cocktail. It's a little different. I started off on 2 pills, and then within 6 months I was on 1, and I'm on that same 1 still. So it's like just doing your own research, like just not being afraid to advocate for yourself and making sure that you're getting the proper care, and just knowledge, just getting tested in general. I think that's one big thing. Like, people are not trying to get tested. So just taking that fear away and actually getting tested, so is a big thing.
Yeah, I totally agree with all of that. When it comes to ending HIV, there's a couple of different things that we think about. One kind of arm that we historically think about is HIV prevention. So this could lead into talking about PrEP, which is the pre-exposure prophylaxis. So, trying to prevent getting HIV. And one thing we have to do to end HIV altogether is increase the use of PrEP. The CDC estimates that there's 1.1 million people in the US who are at a high risk who could benefit from PrEP. So a lot of people need it. When you look at the South is some of the lowest utilizers of PrEP access, and some of it particularly impacts the African American and Black community, that it's known that you just don't have the same access to PrEP. So one thing we really have to talk about is how do we get PrEP to the people who need it? How do we make it affordable? How do we do the visits?
So I'm sorry, I didn't mean to cut you off.
That's okay, go ahead.
And what I've also noticed is that, especially for Black men, they're afraid to ask their doctor for PrEP because they automatically think it's like that gay stigma hanging over them. Like they don't want people to think they're gay, and that's which I've noticed from like some of my male straight Black friends. It's like I don't want to because they're gonna automatically think. I'm like, who cares? But it's still playing in the back of their mind. But it's like who cares? But
no, I agree, and that's something that we can do a better job of when it comes to primary care and in those type. We have some clinics who specifically offer these services, and my hope would be that for those clinics who offer that, we have better educated providers that have removed some of the stigma that's associated with PrEP use. So we can do a better job of a medical community of continuing to educate providers and help remove that stigma. I 100% agree with that. In addition to using the medication to prevent it, that's one arm. The other arm is trying to make sure that if you already have HIV, of getting that undetectable. So that means that your medication is working to where it drops down the amount of virus in your blood where the test can hardly even pick it up. And the reason that we want to try to get everybody with HIV to be undetectable is this campaign you may have seen is called U equals U, which stands for undetectable equals untransmittable. So what the science tells us is even if you have HIV, but your viral load is undetectable, it's virtually impossible for you to transmit it to someone else. So the idea is that if you have HIV, you take your medicine, it's undetectable, you can't pass it on. If you are, inconsistent condom use, a history of multiple sexual partners, frequent sexually transmitted infections, you take the medicine that prevents it. Like those are two of our drastic steps to trying to, completely get rid of HIV one day.
Yeah, you just said something very, very huge, and the U equals U, and then it's virtually impossible to pass that along if you're undetectable. What are, I know that, when someone is infected with HIV, they have to sign what's called the North Carolina control measures. What are the laws about disclosure when someone does have HIV?
Do you want to take that, Chris? Do you know that?
So what are the laws? Like, what are the HIPAA, like from the doctor's point of view or from?
Just from the state, I think, has disclosure laws for, new partners with, people who are infected with HIV.
I'm not aware of it. I know that I had to sign like some HIPAA stuff when I started doing like outreach and stuff like that. But I didn't know that there was something that your partner had to sign also.
Not your partner, but whenever you get a new partner, to disclose that you have HIV. But I think the U versus U changed that a little bit.
Oh, I mean,
equals U.
When in my personal life, when I let people know up front what's going on, and I do let them know that I'm undetectable. I've been undetectable for a while now. But I'm not sure the actual law. But I feel like there's a lot of people that don't say because they feel like once they're undetectable, they don't have to say anything at that point. But I feel like you should let people know, and especially nowadays, I'm a gay man that has sex with other men, so it's like a lot more men are educated on things now. And if you explain it to them, and then there is like PrEP and PEP, so people feel a little bit more comfortable having sex. Right. And there's still condoms. You can still protect yourself. So it's but I don't know. I'm not familiar with the actual. I don't think what you're asking about. I'm not sure.
So the last time I took a look at this, and this is probably, I should probably be more informed about this, but the last time I took a look, I believe North Carolina has a disclosure law where you're supposed to tell your partners about your status. But I might be misinformed there. So I'm going to do some research and
I
I'll make
thought that
sure.
was, is that just North Carolina or isn't that everywhere? Isn't it kind of illegal to have sex with somebody and they don't know your status if you're HIV positive?
So I think that there's different laws if you are undetectable in different states.
Okay.
Well, it
Okay.
Okay,
says,
so
mhm.
yeah, LaShawn is putting in the chat that it's not required if you're undetectable for and then for 6 months.
Oh, I wasn't aware of that. But I mean, I feel like you should still tell somebody though. I feel
Yeah.
like especially if you're in a relationship with somebody, I feel like they should still know, just because things happen. Your medication can
Right.
stop and you get resistance, then you're back to like you just for to be cautionary. I feel
Yeah.
like to say your
No,
partner.
I totally agree with that. Speaking of, if we're shifting gears back to, I guess, rapid testing and what's available for people to know their status. I know that this is a big thing for you, Chris. So I'm gonna go ahead and let you, where people can get rapid tested, where they can find you if they want you to rapid test them, what partners, agencies you work with that do testing, all those things.
So I work for Seeds of Healing. We're in Castle Hayne, so we're here Monday through Friday from 9 to 5. On Thursdays, I'm at NC Harm Reduction, which is on Dock Street between 14th and 13th. I'm there from 1 to 4 on Thursdays. We have other places like the Socorro House, C3. We're starting testing there also for the weekends. We're working with another place in Castle Hayne. It's a treatment center to do testing. I think you guys are testing at Coastal Horizons also. Yeah, the health department, obviously, and then your personal doctor,
Right.
But yeah, I feel like go where you feel comfortable. Go where
Yeah. Yeah, no, I totally agree with that. I think the advantage that we have for those of us that do rapid testing, mind you, at Coastal we do rapid testing in Brunswick, Pender, New Hanover counties, and we'll be able to offer that on our mobile clinics in Blading and the Columbus counties here soon. But
they need it in those counties for sure.
Right.
Yeah.
So our biggest selling point, I guess, for rapid testing is, and this is no shade on health departments or whatnot, or laboratory testing, it was just always, if we can detect antibodies, we can do it within 15 to 20 minutes versus you getting a phlebotomist and they tell you no news is good news. And, within a week to 2 weeks, they may call you and tell you something.
That's the worst thing ever. Those 2 weeks when I got tested, it was like, they were like, if we don't call you, it's good. And I'm like, just wait. Like every time your phone rings, like your heart is dropping. Yeah, that was the worst experience ever. And then now with the rapid testing, we can also do a confirmatory test. So we do a second test from different, like, so you know for sure. And then at that point, you can go to the lab if you would like to, to get in. But yeah, that was a wild time to wait. And yeah, they were.
Yeah, I think again that's always my selling point. Labs take time, and if you want some assurance, rapid testing is definitely the way to go. You probably definitely follow that up with the lab, depending on like what all you want to be tested for. But I know that HIV is definitely, there's enough rapid tests out there for you to do a confirmatory on site.
Right. And I think one important piece to touch on about that is in the very short term, and there's something else we haven't talked about called post-exposure prophylaxis, which means you might have, come into contact with it. But the one piece to remember about this is those rapid tests, sometimes if they're looking for antibodies, it takes time for your system to make those antibodies. So, if you just got exposed yesterday or the day before and you go do a rapid test, like that doesn't necessarily mean you're in the clear if it's negative then. So, you might need to retest again in a couple weeks just to make sure.
Yeah, that's what we also tell them, like, okay, if you feel like you've been exposed, come get this test now, but come back in 6 to 12 weeks and then you'll be able to kind of know a little bit better. Just because that first one was negative doesn't mean, like you said, you got exposed. That's why PEP is good. So sorry, Mackie, do a lot of different places offer PEP, like over the counter currently?
Yeah, so there are some regulations that should make that easier to be able to access now, which is great. So, and there are some really great resources if you look at, if you're pull up your phone and Google like PrEP North Carolina, they have PrEP locators and they also have PEP locators. So that's the post exposure. But yeah, it's much more easy to get now than I think it used to be.
Yeah, because when I talk to people about it, I pretty much tell them like it's like the plan B, but for exposure to HIV. I try to tell them.
Yeah, it's kind of like that. Like you could get it over the counter.
So, are there any requirements? Because I know early on it was you needed XYZ labs to get either one of the two. I think more so for PrEP than PEP, but are there any requirements that you're aware of that go into PrEP and PEP access?
Yeah, that's a good question. So, there's protocols that are kind of designed with the Board of Pharmacy to require a negative antibody test within a certain period of time, because what we don't want to do is prescribe PrEP to somebody who actually has HIV, because it would be doing a disservice, because it's not going to control that HIV. So that's why we need to make sure somebody doesn't have HIV before we start PrEP. Now, if you think that you have been exposed, a lot of times you can get started on that while you're waiting for tests. Whether you're a healthcare worker, you got stuck by a needle, if there was a sexual assault, or if you just are pretty confident that through a partner you were exposed, you can get that started sooner rather than later, because we don't want to wait. We generally want to start the PEP within 3 days or 72 hours of when that exposure was.
And what would that, I guess, what would that entail? Would that just be a consult with your primary care, or well?
Yeah, so there's a variety of different ways that you could get access to the PEP. So you could be able to get it through certain boards of pharmacy. Again, so you could potentially go to a pharmacy and tell them what happened, and if that pharmacy has this protocol implemented and you have proof, you'd be able to give that to them. Primary care doctors are certainly capable of doing this, of treating PEP, and the health department could also do it. And then, like I said, if you Google that PEP locator, that will pull up a list of services, people who advertise this.
And are you familiar with, I guess, the locations? Like you said, there's the PrEP locator. In your experience, has the number of PrEP prescriptions increased over the past maybe 2 to 3 years?
So I can tell you that overall prescribing for PrEP has increased.
Okay.
But I will not as much as it should.
Yeah.
We know that almost half of the people who should be on PrEP in the South are not on it. They have almost, I think the last statistic I saw is that the South accounts for like 52% of new HIV cases. So like 1 out of every 2 cases, but only 1 out of every 3 people are even on PrEP. So, if we got PrEP to be used more regularly, that would maybe help sway that. So numerically there is an increase, but there's still a huge gap between where we are and where we should be.
I totally agree. Wow. I guess now that we've talked about, I guess, preventative kind of measures, I guess treatment and care for those infected with HIV. What does that look like, I guess, in the southeastern region of North Carolina? Chris, I guess I'll start with you.
First of all, just getting tested and knowing your status. So once you know your status, you're able to set up an appointment through whatever doctor or whoever you go through, and then you go start a medication, or you'll talk to your provider about what's the best option of medication, because there is the new situation where you can get the shot every 2 months, but it's also like you have to get on a build up of medication. You can't just get the shot and then you're out here. just chilling. You know, you have to get that build up and then make sure it's in your system and make sure you don't have a resistance.
Excuse me, let me correct that. Those living with HIV. I'm sorry.
Yeah.
Let me humanize it. I'm sorry. Okay, and again, there's many different options to obtain treatment, whether you're uninsured or you have Medicaid. The Ryan White funding structure does a lot for those that are uninsured. But it's very accessible once you, like you said, you have to first then pass go with your
Once you
status.
know about it, because
Yeah, yeah.
most providers aren't going to tell you about the Ryan White off gate. You have to kind of do your own research, and that's from my experience. And I feel like if you have to do your own research, so listen to what your provider is telling you, but also make sure that you know that you're advocating for yourself. Make sure you have your own stuff going on, and you're not just like waiting for them to give you stuff. You have to kind of get out there and do your own work also, because it is your health.
Uh-huh.
And then I think the biggest thing that we are kind of lacking at the moment is mental health awareness also, because that's a very, very, very tough time. Luckily for me in my personal life, my mother's a therapist. So when I first found out, I was able to go to her and my dad because we're very open. But a lot of people don't have that family structure or that backing. So make sure you're checking in with your mental health is a big, big, big thing for me. So yes, I want your physical health to be good, but your mental health is really, because there's a time where you can go through of like not want to take your medication just because your mind you're going through a lot in that time. So sometimes it's easy for you to be like, I'm good, I don't take this medication, especially once you become undetectable. For me, when I first became undetectable at a young age, I don't know when my mom was like, oh, I'm good now, I don't have to take my medications anymore, everything's fine. I found out really fast it's not true. So just checking in with your mental health, making sure you're checking in with your mental health is a big, big, big part of it for me in the treatment thing, process of treatment.
Yeah, I think there's a question for you, Chris. How important and helpful was it to have the family and friend support?
It was very helpful. It was very, very, very helpful. I was in a dark place. Again, like I said, when you mentioned the laboratory testing, it took you a week to 2 weeks. So that whole time I was panicking. I didn't tell anybody while I was waiting, but once I got my results, I did call my parents immediately. But just having them there and letting me know everything's gonna be okay. Let me know that they still love me. There's no judgment. They weren't gonna make me eat from different plates and forks at Thanksgiving and things of that nature, which I've heard stories about. So it was just that reassurance made me feel a little bit better. Even know that to this day I'm still kind of battling with forgiveness of myself, or just letting myself some grace in a sense, because again, I was raised by my mom. She had me really young. She had me at 16. So whenever me and my siblings were growing up, she always said, protect yourself, protect yourself. When I first told her I had sex, she made sure I got chest tested the very first time when I came in. So she was always, her and my dad were always advocating for protection, protection, protection. And it just made me feel like I kind of let them down and myself down. So just giving myself that grace. But it was very important. I don't know where I would be right now if I didn't have that backing from them and my siblings. I don't know where, honestly.
Yeah, I feel like not everyone has that, especially that openness with parents and whatnot, uh, to be that forthcoming and that protective, or just making sure that you are moving in the right direction. And I do know for new cases and whatnot, I think that there's more resources than people would think. Just like you said, you probably have to do your own research, but between patient navigation, case management, there's resources between Ryan White, Medicaid, and your insurance company, if you have one, to get the mental health treatment that you need, to obtain
Also,
good.
Montrel, but I've also realized that because I got tested, because when I got tested, I got like they called me and said, "Hey, you got one of your partners or whatever, come into the health department." I was like, so when they called me back in 2 weeks to tell me the news, I kind of just got up and left. There was no like, "Hey, would you like to talk to our therapist?" or "Hey, would you like to talk to somebody?" There was none of that. They were like, she was pretty much like, "Are you okay?" I was like, "Yeah," and I just left, and I drove myself home. There was, I feel like there was no middle ground. Like, take a moment. Do you need to talk to somebody? There was no like therapist offered at that moment. There was no counseling offered at that moment. And for me, luckily, I did have that background. But there's a lot of people that don't. There's a lot of people that would have went on a binge, would have went on a very harsh, roller coaster of you just don't know. And I feel like that's something that we, which I hope it's getting better now. But that's something that I really wished was there when I was told. And I was told in 2016, so I can only imagine how it was before me,
Right, right.
And so it's just like I wish that was a bigger part.
Absolutely. I mean, you hit the nail on the head with that. I think that, also we in the healthcare community are more aware of, trends and whatnot. But I think that as a social community, I think most of our different social groups, they still are uneducated and often rely on stigma that they learned in grade school or what have you in order to gear their views towards HIV and its transmission routes and who's the most vulnerable population. So I think there's still work to be done, very, very much so in that realm.
Chris, I was going to ask you a question. And I don't know you or your health history, so this could backfire on me. But how long was it between when you got diagnosed and when you started medication?
Maybe a few months. I got my appointment pretty soon, but I think we talked about medications first, and I just needed a moment because they the moment of like, do you want to do this way? Do you want to do it like a holistic? And my nana, she's like a bruja, so she was like, we're gonna cut up these herbs and rub some turmeric on your forehead, and you put this garlic in your ear. And so it was just, I think, yeah, it's maybe 3 months when I first got on it.
Okay.
Maybe.
So started it pretty quickly though.
Yeah.
Since that time, especially since you've been on your most recent pill, has there been a big risk of taking that medicine? Has it caused side effects that you couldn't tolerate? Like, looking back at it now, is it worth taking the medicine?
I think it is. Last year I had a moment, I'm gonna be completely honest with you. Last year I had a moment where I had a small mental break. So I was on like mood stabilizers, antidepressants, and I was taking my medication. And I was having awful dreams. I was having like terrible like night sweats. I woke up like soaking wet. It was just so I stopped taking all my medication at that point. So I ended up in the hospital for like a week just because it just went. So I don't advise that to anybody out there, but it kind of gave me a more appreciation for life. I was very depressed. I was very depressed, and it was just so many things swirling around in my head. And I was just like, this medication is all making me sick. So I'm gonna stop taking everything at one time, and I'm gonna feel way better. And I did feel better, but I also got really sick. So it was like, to answer your question, no, but I think it might have been just a bad mix for me with those things in my already standing mental health.
Yeah. Well, I think one time, so, one reason people are frequently scared to get on these medicines is because, like someone's saying in the chat here, these medicines used to be terrible, just like the hepatitis C medications. They used to cause so many side effects. But now, starting on medications now, the chances of those single medicines now, when we start talking about interacting with other meds and stuff, that becomes a little bit trickier. But, you start on a single pill today, and the chance of it causing side effects that make you just completely want to stop it are so much lower, so much smaller than they used to be. So the medicines now are much better tolerated than what we had, in the 90s.
For sure, but that's why I keep saying like to check back in with your mental health too, because that was what it wasn't the medication at all. It was just not a good combination with my mental health.
Sure.
So that's why I'm like, yeah, I have no problem with the medication. I'm on the same medication today. So it's like, but it's that check in with your mental health because sometimes your mind can start doing something that's against your body and you don't even, know what's going on.
I mean, then we could talk about the stigma with men and mental health as it is already. So that's a whole nother webinar.
For sure. For sure. And then you got people that are talking about sativa. Dr. King, you might have to say that last one. I don't want to mispronounce it.
Cabenuva, that's
Yeah.
that's a long-acting injectable medicine. So for some people now, they can be on instead of having to take a pill every single day. Once you get stable on it, you could be on a shot every other month or so.
But it takes a lot to get right. Don't you have to go like? Don't you have to have like shots up into that situation, or don't you have to take pills up into that situation? Or you
You don't have to do that anymore. When it first came out, you had to.
Mm.
The way it starts now is first you have to start off as undetectable. So you can't, this isn't a medicine we start in people who are newly diagnosed. You got to be on something that gets you undetectable, and then we can switch you over to the Cabenuva. And then you come, it's 2 shots, you get one each butt cheek. You come 1 month later, 2 shots, and then from there it's every 8 weeks from then on.
Yeah, I know the one that everyone harps about is the interferon that used to be a treatment for a
Hep
couple
C.
different Hep C, and they just talk about how it would just tear people up.
It was terrible, yeah.
What is? Anywho,
And I have one more question about the shot situation. I'm sorry. So what happens if you miss an appointment with your shot or with your what happens in that? Can you make that you make that appointment back up, or what happens if you drop like?
Yeah, that's a great question. So what we know is that you have about a 7-day window on either side, right? So if you know you're going to be out of town, we can give it to you a little early, we can give it to you a little late. But what happens is when this starts happening regularly, right? Because if you're on a pill, you take the pill, you basically kind of re-up the amount of medicine in your body every single day. Versus if you get that shot, like slowly over time, the amount of drug starts to go down. So if you keep pushing it 9-10 weeks, the virus might have a chance to grow. And then you get a shot, and then 9-10-11 weeks later, it gets to grow. So like in our clinic, we have kind of a contract that says if you miss so many appointments for your benefit, we might need to switch you back to something else. But you do get a little bit of a wiggle room there. And if it just happens once or twice, it probably won't be too bad.
Okay.
But some people you do have to get administered by a healthcare professional. So, going into the clinic or something, some people don't like that.
Yeah, so that's something you can't do at home. You can't be like, just send me the shot in the mail and I'm gonna do it myself.
Correct. Correct.
Okay. Wow, that was a deep dive on like HIV medication. I'm glad we have, 2 experts in here. So I guess our last thing, how do we enhance the current approaches to addressing the epidemic? I feel like we've answered this, but not totally, whether that's, policy or youth education. How do we normalize testing? Like, do we bundle testing into like an A1C test, or how would that look for you, Dr. King?
Oh, I think you guys could probably speak better to this than I can with the harm reduction initiative that you guys take care of. I mean, that's an interesting thought, is if we were able to bundle it with something else. We have some initiatives with the hospital, like where we might go into barbershops and, we'll test blood pressure, we'll test A1Cs, we'll give vaccines, and normalizing it, doing HIV testing at the same time, like that might be a great thing. So partnering it with other health or with other screening opportunities like that could help remove some of the stigma. But honestly, I think you two are the professionals here.
Well, so with anything, I try to normalize it. So with naloxone and Narcan for people, I always try to say this should be a part of a normal first aid kit, because whatever that may be. Same thing with you get bundled a test, whether they're checking your lipids or whatever. Maybe add in a couple STD screenings. But go ahead, Chris.
Oh, what was your question? You're asking like how we can more so normalize it, or more so make
Yeah.
I don't think there honestly is a way to normalize it. I think people are going to have their misconceptions about it. You can give as much education as you want. You can give as much. You can get your favorite rapper to rap about getting STI testings and getting. I just don't. I just think there's just that fear in the back of your mind, and it's passed down fear. Like you as Black men, we already know that we have what we grew up with fear. I'm not sure if I can speak for you, but we grew up in that fear mindset. You don't go to the hospital. Doctors are not there to make you feel better. They're there to take your money and tell you a whole bunch of shenanigans. That's how I was raised.
Mm-hmm.
Mary was raised like, we're gonna fix this problem in the backyard. We're gonna
Mm-hmm.
we're gonna pull this stuff together. So that's it's just getting past that fear of going to the doctor, getting that, because there's white coat syndrome now. People are getting diagnosed with white coat syndrome every day. So it's like that fear of doctor, your blood pressure shooting up every time you go to the doctor's office. So it's like just getting past that. So I don't know what we could do, honestly, to get rid of that stigma, besides just giving as much education as possible. And people have to actually want to soak it in. People want to have to change their mindset of how they feel about HIV. People are still, like I said in the beginning, people are still afraid to say it out loud. Like people are, they want to whisper it when they, oh, so how are you? Like they want to whisper it, and it's like, say it. If you say it more, it takes away from its power. Don't be fearful of it. It's something that can be in control. Like we just talked about, there's shots, there's PEP, there's PrEP, there's medication. We got this. There's no reason to be fearful anymore. Mm-hmm. Cautious though. Please don't take that as me not saying be cautious. Please be cautious.
Right.
Be fearful is a different thing. There's nothing to fear anymore at this point.
Yeah, as providers, I mean, we can certainly do a better job too. As you know, that when you're talking about the whispering HIV, I think providers do the same thing when it just comes to sexual history in general, right? Mm-hmm. So, when's the last time?
Weird thing to talk about. It's a faux pas a lot of times. People don't want to.
Yeah. If we as a healthcare community do a better job of taking a good sexual history, understanding when our patients may or may not be at particular risks, then hopefully we're offering appropriate treatment at that time. So I think more education amongst the healthcare community and removing stigma of talking about sex and doing sex screening or sexual history screening can also be helpful.
Talking about sex, yes. I took sex ed in 5th grade. I don't know what's going on nowadays. I guess it's out of school. It's out. I'm not saying that it's stuck over here, but I'm just saying I took it. So I had the option. Like I had the knowledge, you know. So it's like, yeah, I'm not sure. But from your profession, from your point of view, Mackie, are you guys allowed to just you have to ask people if they want STI testing, correct? You can't just test people when you're doing other tests, or you have to ask, do they have to give consent for that, or?
So in a clinic office, we should be discussing with the patients what tests we're ordering.
Okay.
I mean, nothing should necessarily be a surprise. Like if I'm going to order some STI screening for you, or for screening for gonorrhea, chlamydia, syphilis, I would offer that to you. I shouldn't be sneaking around your back and ordering it, especially if you don't want to be screened in particular. But it should be an honest discussion with your provider, with the patient, about what tests are going to be ordered and why.
But no, and the other, I guess, bold point there was education as far as adolescents are concerned, especially here in North Carolina. Just like you said, in 5th grade, back when I was in 5th grade, same thing. It wasn't really, it was DARE and sex organs. That's what they taught us in 5th grade. Get to high school where they were talking about health education and whatnot. We learned abstinence, which in the first,
they taught us something in my school. They were like, "This is how you do it. Pinch this thing, roll this thing down."
They never even got that far with me in high school. Like that was just something that was faux pas, like you were saying. Like we teach it by saying don't do it. Abstinence is the only way. I know things have gotten a little looser in previous years. In fact, I know I've done 1 or 2 high school classes where they actually were allowed to talk about some things further than abstinence. But I think that's the other part, though, is like actually showing this could lead to this, and what that actually looks like. Okay. Well, do we have any burning questions that anybody has presented? I think we've covered a lot of things in this hour that we've been on. First of all, and Chris, I do want to commend you and thank you for being so open and so vulnerable on this platform.
Oh, of course, I love to talk, so that's one thing. Like, one thing I do is I love to rap about. But no, like this is something I'm really passionate about, especially now just working for Seeds of Healing for these last few months. I've been able to talk to more people out in the community, and it's just something that I'm very passionate about. I don't mind sharing my background or my story, especially if it's going to help somebody else, make them feel a little more comfortable, and let them know like you can still you can still look great and be, what I'm saying, and still live in HIV. You can still be out here looking good, living my life, stuff. So it's not it's not a death sentence for anybody. Well, thank you for facilitating, and thank you for being here, Dr. King.
Well, thank you guys. I appreciate your lived experience, and it's something invaluable that no amount of education or nothing else can replace that. So I'm happy that you're on here, and appreciate the discussion today.